Hello everyone, my name is Dr. Colette Amit. I am a physical therapist and the owner of Physical One in Plantation, Florida. Today I would like to give you an overview of the reasons you may be suffering from shoulder pain and what can you do about it. The first group of injuries relates to instability, which can cause dislocation of the shoulders or subluxation. The second group of issues relates to the rotator cuff. Those are a group of 4 muscles and tendons which over time, secondary to disuse or a trauma, can suffer inflammation or a tear. The third group of issues related to shoulder pain results from arthritis, just like the knee and the hip. The cartilage get damaged, and as a result, you may be suffering from pain. So what can you do about it? There are a few tips I can suggest for you to take into consideration. The first tip is listen to your body. If your body tells you that something does not feel right, please stop and examine the issue. The second thing, stay active. Do exercises. Stretch on a regular basis. The third tip, if you are lifting weights, please make sure to learn the proper body mechanics and lift the weight properly. In physical therapy, we are teaching 2 types of exercises that could be active stretching or strengthening protocol. We call it PNF, Proprioceptive Neuromuscular Facilitation. In 2 diagonals only, you can activate every muscle in the upper extremity. The motion goes in diagonal. There is diagonal 1 and diagonal 2. They are multi-planar movements. And the first one, you can go to your opposite hip, such like if you are going to take a sword out of the holster and swing it above your hand in this manner. And then you bring your arm back into the opposite hip. This particular motion could be done with 2 hands, and you can bring the hands up in that way and bring the hands back into the opposite hips. Please note that you go from one extreme movement to the other. We call this active stretching, and you can incorporate a TheraBand or a weight to make it a strengthening exercise for the damaged shoulder. So for example, you take it all the way up this way, above your head, and return slowly back to the opposite hip. Again, it could be done with both hands, with weights or TheraBand. The second diagonal, you are going to go from the opposite ear, just kind of in diagonal behind you, and back this way. So the proprioceptive neuromuscular facilitation will help with active stretching, gaining range of motion, or you can use it with weights or TheraBand to strengthen the arm in those diagonals. Again, it could be done with both hands to activate those muscles. This is a short introduction for PNF, Proprioceptive Neuromuscular Facilitation. If you would like to know more about these effective tools, please reach out to us. Physical One, 954-741-2221. It was a pleasure talking to you. My name is Dr. Colette Amit.